Now, our next topic is rheumatic fever, which is a serious condition that can affect children and teenagers, potentially leading to long-term heart disease or problems if not detected and treated early. Awareness about its symptoms and prevention is crucial for every parent and caregiver, and today we bring this conversation directly to you, our viewers, broadcasting live right here from the Ongwediva Annual Trade Fair, of course, to show communities to get involved in promoting children's health. And to help us do this, I'm joined by Dr. Godfrey Mbawala. He is, of course, a pediatric cardiologist and is based at the Ongwediva Medipark to speak to us more on this condition. Doc, very good morning to you.
Good morning.
And thank you for being with us here.
Thank you for having me.
Of course, a very serious condition that we're speaking of here, Doctor. First and foremost, perhaps I think let's break down what rheumatic fever is, how it occurs, and of course, its potential impact here.
Well, I'll try to avoid some jargon, medical jargon,
Yes,
and try to be as simple as it can.
Yes, please.
So, rheumatic fever is a sequela of bacterial infection. It's a multisystemic disease because it affects more than one system.
Yeah.
It affects brain, it affects the heart, joint, skin. Yeah, that's pretty much.
Yeah.
And like I say, it's a sequela of bacterial infection.
Yes.
To be specific to which bacteria, because a big group of bacteria
Yes,
is a streptococcal group A, beta hemolytic bacteria.
Yeah.
Yeah.
And why is it often found, in children and teenagers? What makes children and teenagers susceptible to this bacteria here?
Well, I mean, it's not only affect children. To be honest, it can affect anyone. But
Most
children,
cases,
most cases are in children because they are at risk because of, among of the risk include the overcrowding. And as we know, kids are usually, even if you are staying at home, all the people tend to isolate themselves, but kids always tend to be together.
Yes,
so.
yes.
Them going to school, overcrowding environment, even if at home they may not be living in the overcrowding, if they go to school and they're overcrowding at school, But I must say, must put it out that rheumatic fever is a disease of poverty. So among of the high risk factor for the rheumatic fever is to have overcrowding, to have poverty, and I will explain why poverty. And then we have genetic predisposition, and also genetic predisposition come with the family also because running in certain families, there's a genetic component of that.
Very much.
Yeah. So why did I say poverty? Because, like I say, this is a disease which someone is getting. I'll come to pathophysiology later to explain how does it happen.
Yeah.
But as it is, you get sore throat, and then if it's not treated, then later on get problems. So we know poor people are not having access to the medical care, or if they have, they will take it longer. I always teach also medical students, so I say among of the things I ask them, just like to teach them, like when there's poor people going to the hospital, when the kids are threatening to die, basically, when when are the rich people go to the hospital?
Almost immediately.
When the child sneezes, they take them to the pediatrician. So that's make a big difference when it comes to rheumatic fever. So if untreated respiratory infection, then they get it.
So what starts out as a strep throat or scarlet fever infection can ultimately lead to heart problems.
Yes.
And talk to us about, the advanced stages of rheumatic fever and also the lifelong impact of that here.
Okay, like I said, it starts as a really innocent disease, just sore throat out there, and then if not treated, then later on the bacteria, is the usual. The body normally reacts to this bacterial infection as all infection by their defensive mechanism making antibodies so that they can fight this disease. So it's the same for the rheumatic fever. So you get sore throat, and then the body tend to make antibody to fight this. Yes, but one of the component in this streptococcus pyogenes, they have M protein.
Okay.
This M protein, their function is try to avoid, they are also surviving more, trying to avoid these
defense
mechanism of the body.
Yes.
So they have that.
Yeah.
Unfortunate for the human being, those M protein, which are meant to protect them, the bacteria, they have similarities with certain structure of the human part, okay, including like brain and heart, joint. So because now the body is reacting to clear the bacteria, and the bacteria come up with the M protein, the body will detect it, and then will make mechanism to clear it. But since there are similarities between the bacteria, then the body cannot tell the difference, and now it starts like tearing itself, tearing itself.
Yes.
You know,
that's
so
in essence what autoimmune.
That's where autoimmune come in.
Yeah.
So you get infection, and then this process. By the time you start having rheumatic fever, maybe even the infection has already been clear. You know.
Yeah.
But the effect is there. So the worst part is when you have now recurrent. Having one episode, it may not be that bad,
yes.
But when now you start having recurrence, that when now is a big problem. Yeah.
Doc, in your professional medical career, how often have you come across this condition in Namibia?
Well,
how prevalent is it? Yes.
It is, unfortunately, it's prevalent, and it's prevalent, like I say, in underprivileged people.
Families, yes.
You know, I'm working private, and also I'm working in state hospital as a pro bono, part of the contract between our hospital and the government. So I don't see so many patients from my practice in private sector, but I see a lot of patients from Oshakati, Onanjokwe, and other places where I go see the patient as a part of pro bono, and especially, unfortunately, from Angola also. So I have a lot of patients from Angola. I have a database I was just trying to peruse this morning to see how many patients I have in the database to give you a context. I think I have more than 50 patients who I follow up. And when I follow up, these are the patients who has already have heart problems. So we're not talking about rheumatic fever now. We're talking about the sequela of rheumatic fever. And these patients are at different stage. Because there are those who are having simple lesion, which we just need to follow up, and secondary prophylaxis. We have patients who have already now like a full-blown heart condition, who are waiting for surgery because My
goodness.
Yeah, so.
What kind of bearing does this have on the health system as we know it? Talk to us about the broader impact of rheumatic fever.
The broader impact is cheap to treat rheumatic fever.
I mean, but undergoing heart surgery.
But undergoing heart surgery is really, really expensive. I mean, I don't have like a data. Now it depends on which surgery now because the two big valves which are involved here, the mitral valve and the aortic valve. Sometimes you have a child who has both valves affected. So then it's like now you have two valves.
Wow.
Okay, I'm not a surgeon who they're always dealing with these stuff. They will tell you what like only one valve costs. Let's say only valve. I'm not talking about the valve. I was talking to a surgeon the other day. Say like it's around 30,000, not 30,000 for a valve. That's not even the operation. So the operation itself can goes up to 300,000 for one operation.
Sometimes you're looking at transplants, etc.
But transplants, since we don't even have it, I can't even discuss it. So I'm not even talking about talking about repair and replacement of those valves. It's very expensive, and the treatment of a patient who has been a valve replaced, long life treatment, because those kids now all of a sudden they need to be on certain medication to prevent the valve clotting, because this valve most of the time they have metallic component which will make them prone to get clots of the valve.
Absolutely.
And even treating them with those medications become very difficult, to be honest, because kids, unlike adults, they are playing outside, and these medications they can make their blood thin, and when they get injury it becomes
a problem.
It's become a big problem.
Doctors, in conclusion, of course, the importance of creating awareness around this. We are at the Ongwediva Annual Trade Fair. I know that the Ongwediva Medipark, of course, is also present here. So talk to us about getting the message across to the public, yes.
So what we've decided for this week at our hospital, we are going to have sessions at the ground, yes. But also we are very happy that you allow us to go to reach the community and speak about the disease. So at the ground, we'll be at the Queen's Hall, where we have flyers. Fortunately, we have our partners, our friends from Windhoek Central Hospital. They've provided with some of the flyers, which have not only English version, and also they have some Oshivambo version, just so that we reach the message cut across. Yeah. I'll have a session with the students to speak about this at the trade fair, I think on 29th, and also we are going to have a radio presentation. Unfortunately, today I was supposed to be coming with one of my patients, a girl who is living with a condition with rheumatic fever. I just wanted to give.
That would have been lovely.
It would be very nice. Yes, unfortunately, yes. The arrangement has been difficult. I got the information that I'm getting this session today on Monday, and the information get to me on Friday, so it was short time, yes, and she is in boarding school. So it's understandable, and her condition as well, it's understandable. Well, so it was difficult. I'm sure she'll be very upset with me because she was excited to come to the TV.
We'll try and pursue that still. But Doc, it's been a real pleasure talking to you.
Thank you very much.
And we wish you all the best with what you're doing at Ongwediva Medipark. Okay. And of course, all the best with the rest of the week here at Ongwediva Trade Fair. Yeah.
Thank you very much.
Yeah. There you have it. Dr. Godfrey Mbawala, of course, he is a medical practitioner, of course, a pediatric cardiologist, talking to us this morning. He is based at Ongwediva Medipark. This morning we unpacked rheumatic fever, of course, a common condition affecting children and teenagers, condition of the heart that starts out as a small bacterial infection. And of course, just informing the public there to please ensure that you do take care of your small ones as soon as possible, as soon as any symptoms are shown. You stay with us. We'll be right back. This is Good Morning Namibia.